So we're really happy that we've got this amazing bit of kit. It's going to revolutionise how we manage children's airways and also expand the sort of uses that we have for them, in particular going into looking at newborn babies, swallowing assessments. And what we can do is we can pause it and we can actually go frame by frame and really slow it down and look very closely at what we're trying to assess. So the applications are significant. We'll probably be seeing at least 650 patients per year with using this sort of technology. What we'd do with this telescope is I would pass this down the patient's nose, and then I'll be able to angle it, have the light on it, video, and I'll be able to angle it down and then look at their voice box. So not only can I evaluate the nose and the back of the nose, but I can be looking at their throat, in particular their voice box, so for any airway problems. But what we're doing is we're expanding our service to look at patients, babies, newborns with swallowing problems, and then traditionally we've been having to use X-ray to evaluate that, whereas now we can actually look at it directly. And so this is one patient where we are feeding them whilst we're looking down and able to sort of assess their swallowing.
I discussed this with the clinical team, and they were looking for a system that was portable, that was easy to transport around the hospital. Also offered a chip-tip scope, which are the new scopes which have been designed by Zion. Traditional scopes used to use glass fibres which used to travel through them. This scope uses a camera processor which is attached to the end of the scope, which allows FEES examinations to be carried out by the clinical team. The system allows video editing, and it allows the capture of sound, which is also pivotal for speech and language teams. The system also allows you to edit videos and photos and send them into the hospital network PAC system, which allows data archiving and video archiving to take place in order to be able to reassess patients after they've been examined in the hospital clinical environment.
So the old machine was so old that I'd often used to say to the children, right, we're going to examine your nose and your throat today, and if you look behind you there's the TV which we can look on, and the children would turn around and look and say, well, where is the TV? And it was so old that the TV was this sort of cuboid, massive machine, and they just didn't recognise the monitor as what they think of as a TV. They think of the TV as a flat screen. So this is obviously much more in keeping with what they would be expecting now, and the technology's improved so much.